Health literacy is a misleading term. You think about writing and stuff like that. You don't think of the other components of it.
We went with this course in particular because of its practical component, and it allowed people to actually implement work that was valuable to them in their workplace, for organisations to become more health literate so that they could actually assist the people that they work with to understand their health needs and to make choices that were relevant for them. When they went to these courses, they could use the information and the knowledge that they gained back in their workplace in a practical way to progress key pieces of work that were important to their organisations.
First project we looked at our 1300 number, which is our central service access number, and we had a look at the scripts that were being used by the workers there when they take that initial phone call, and looked at how we could provide it in a format that supported them to use easier English when they were making that initial call.
So we had some existing documentation, and some of it pretty policy heavy, and we thought it'd be really nice to have a user-friendly, almost like a checklist about what works, what doesn't work when we're conveying information to our consumers.
So we started that process by delivering a short training session to other program advisors and monitoring coordinators to sort of get a bit of buy-in from our peers.
Doing a bit of an investigation of our written communication, both at Manningham Community Health Services and then at Inner East Community Health. And then we looked at creating one written process for our new organisation.
There were loads of acronyms and it was quite complex in the way that we were asking the questions. So we basically got all stakeholders really to participate and give us some feedback in terms of what that looked like. It was great for us to be able to address it in terms of the health literacy course.
That's the goal, is to sort of start off small and then cascade that onto something bigger. Hopefully we can run through with that and have a whole organisation approach to health literacy and data analysis and understanding.
Today we're here for the Health Literacy Senior Executive Forum, which is an important part of the Health Literacy Development course. We're asking agencies to select people that have a potential or actual change agent role in the organisation, and we're asking their executive sponsor effectively to create an authorising environment for that change. So it's a good opportunity for execs to hear about what's going on in other organisations. It's a good opportunity for them to reflect on what's going on in their agency.
The Department of Health and Human Services is very committed to health literacy. We've got 2 staff members who are participating in this course, and they have made some great changes already. I think the key factor for me is ensuring that these 2 staff members participate in a range of meetings and workshops to inform the rest of the organisation around health literacy.
I think it's so important that as an organisation we understand things from a consumer perspective. It's about education. Education of staff is very key, and support from other organisations possibly that have undertaken the journey, which actually always helps.
So our commitment is to make our services understandable to people, and that's very important to us.
Because when you merge an organisation, you have to revise all of its policies and procedures and statements and processes. And so you can add some of these sort of contemporary contextual things. You can bring health literacy into being a core part of a new organisation.
And primarily our aim is about enabling people to be included, how they choose, in their communities. And to that end we realise that health is a core driver of the opportunities for inclusion for people.
I'd be hoping that we'd get a commitment to some ongoing education and training for our staff so that it becomes core business, part of what we do.
We really believe that it's actually our responsibility to be an inclusive organisation, and to be inclusive we have to be accessible. I think the most important factor in succeeding to become a health literate organisation is actually ensuring that the voice of our consumers are actually part of driving that message within the organisation.
Just that one small action had a ripple effect across the entire organisation. It was great for participants to be able to follow their learnings to a small project to a really big outcome in their organisation.
Really raised my awareness about health literacy and how it could apply to my own practice. But I was interested in developing this longer course so that I could go back to my organisation and build the capacity of the organisation as a whole.
Once our participants had really cut their teeth with their first project and built their confidence, they then rolled on to a second, bigger project internally within their organisations. And this is where people were able to get creative and harness kind of the momentum that was already going on in their organisation and build on their first project to something that's aiming towards quite significant organisational change.
So we're at Link Health and Community, and today we're at our Clayton site where our oral health team resides. Marie and I wanted to talk to the oral wellbeing team about health literacy generally and about some of the specific work that we'd been doing and how the learnings that we've taken from the course could be applied to clinical practice for our dentists and dental assistants. Today was more sort of planting the seed than anything else, I suppose. Marie and I have met with the general managers of each department, and as part of that strategy we're addressing the different teams to give a little introduction to health literacy. I thought the dental team today were quite open and receptive. I think it was good for them to have a little bit of a reminder about health literacy and to know that there'll be more work being done in this space going forward.
What we found when we spoke to the participants was that there were a lot of secondary outcomes. They were becoming the go-to person for health literacy.
For the participants, making sure they had their executives on board, they'd been communicating across departments and they were involving consumers in their work. Kind of working at all those levels ensured that once this course was finished that there was still momentum, there was still work going on, and just really reinforced the sustainability of this work. Really satisfying or encouraging for us to see that we knew this investment, and for us and for the participants, would pay off long term, that it wasn't something that would go away once the course went away.